Good afternoon, everybody. My name is Massimo Fumagalli. I am an acupuncturist, MD, from Switzerland. I will discuss today about obesity and acupuncture, few aspects of obesity that maybe not everybody knows. I have some disclosure to do. I am the founder and shareholder of the group Sinomedica in Switzerland, and I am one of the sponsors of the SAME Symposium. Let's start by a good news. Today, the public and the people like more and more acupuncture and traditional Chinese medicine. There are often articles, even on major journals, advocating for integrating acupuncture and Chinese medicine into mainstream medicine, even if we are aware that worldwide there are differences. In Switzerland, it's pretty positive, the situation. Okay, today the discussion will be about few aspects of obesity, the fact that it is a pandemic. We will discuss about the insight, some insight into the neurobiological mechanism of obesity, what is the research and what are the results we have from acupuncture in obesity treatment. And then I will share at the end with you some results of our clinical experience and ideas about future project of research into the field of acupuncture and obesity. These two questions, I think, are important, and I am continuously confronted with that in my clinical activity. Why we just continue to say to our patient that eating less and moving more is the solution for their problem, for their obesity problem. And why is acupuncture not yet integrated into mainstream treatment for obesity? This is our evolutionary story. This short movie will show the evolution of the obesity pandemic in the world from 1991 to 2014. It's pretty impressive. And the colors coming out, the darkest color, they represent only the people with a BMI above 30, so real obesity. Let's see how it is. Anyway, we have a lot of data about the immensity of the obesity pandemic. The OECD and WHO recent data are talking about a huge pandemic, or let's say obesity death toll, around 13,000 deaths per day. And they could be, a lot of them could be preventable. Another incredible number we have is the fact that 1 in 6 children in 2017 was obese or overweight in OECD countries. In 2019, 38 million children were under age 5 were obese or overweight. These are shocking realities and shocking numbers. The next slide, I will show you the rate and the projected rates of obesity growth of obesity numbers in the world. The obesity rate is growing at a continuous speed. In America and USA, almost 50% of the population will be obese in 10-year time, so by 2030. But as you can see in the slide, America is not the only one having problem. Switzerland, Italy, Korea, Canada, everywhere in the world, the obesity rates is growing. Obesity is one of the most important death risk factor worldwide. It was the number 5 risk factor in 2017, death risk factor. Obesity is associated with an increased risk of morbidity from different diseases. Cardiovascular disease, type 2 diabetes, non-alcoholic fatty liver disease, respiratory disease, cancer, etc., etc. It has a huge impact, economical direct impact on global GDP. It costs around 2 trillion per year, which corresponds to 2.8% of the global GDP per year. is huge. It's really important. It could be comparable with the same amount of cost the cigarette is causing in the world. And furthermore, today obesity has become a very huge item, a very huge hot item, because the obesity pandemic is joining the COVID-19 pandemic. Recent studies and recent research shows that obesity changes the immune and the endocrine response of the body, creating a low-grade chronic inflammation and an immune hyperresponse. Therefore, it worsens the clinical outcome of COVID-19 patients. And not only this, it has, as you can see, it has cardiorespiratory fitness is reduced with obesity, the susceptibility to inflammation-induced cardiovascular complication is higher, etc., etc. The viral exposure, of course, is higher with less immune response. So obesity is really important. Okay, let's move to a slightly deeper view of the obesity disease. Obesity is not only weight gain, but has many factors as cause. It is a multifactorial and multidimensional problem. We have a genetic factor, we could have epigenetical factor, we could have environmental factor in influencing obesity, psychosocial factor, economical factor, political factor, cultural factor, and neuroendocrine factors. Today, I will discuss only the neuroendocrine and some part of the neuroendocrine aspect of obesity. There are many hormones and neurotransmitters in intestinal tract and hypothalamus. They are linked to weight control system. They have a complex and multidimensional interaction. They control, at the end, satiety and hunger, and fat storage, actually. The two main hormones I would like to discuss today are leptin and ghrelin. Leptin is produced in the fat cells, ghrelin in the stomach. Ghrelin and leptin control hunger and satiety through the hypothalamus. Before eating, ghrelin increases, giving hunger feelings. After eating, leptin counteracts ghrelin and take away the hunger feelings. They regulate also the fat storage, of course. One of the main endocrine causes of obesity is the development of leptin resistance. Leptin resistance has a similar mechanism like insulin resistance, which is, of course, the cause of diabetes type 2. When the fat cell is overloaded with lipids, the leptin production deteriorates. This leads to a vicious circle called leptin resistance. The end of the equilibrium between leptin and ghrelin cause the loss of satiety and a growing hunger feeling. This, of course, is a simplification of the neurobiological mechanism of obesity. But anyway, with leptin resistance in obesity, there is no more sense of satiety. Of course, there is further food intake, and there is a growing fat storage, creating the condition to reach obesity, that lead to obesity. What can acupuncture do for that? Do we have any evidence? Is that possible for acupuncture to help this situation? Can we change something? There is scientific research. Of course there is, and there is also quite a lot. I would not say we are 100% sure, but the interest into this field is growing, is becoming more and more important, like we can see, for example, in the numbers of PubMed. If we look acupuncture in PubMed, we find around at least 33,000 results. If we look acupuncture and obesity, as you can see, we find 500 results. So the articles on this field are quite a lot. What can acupuncture do? What have we seen? The literature shows that acupuncture has a positive role, of course, in the treatment of obesity and diabetes type 2. Why? It induces body weight loss, loss of appetite, it downregulates insulin and leptin resistance, it upregulates leptin receptors, it lowers ghrelin levels, it decreases glucose levels, pancreatic glucagon and cytokines, it improves glucose tolerance. Of course, these have a positive role into diabetes and obesity treatment. I show you some articles now, more recent and less recent, about acupuncture and leptin resistance, as well in animals as well in humans. For example, this one, it is an article of 2013. It shows that acupuncture, electroacupuncture, can downregulate, can reduce leptin, so creating in obese rats, so decreasing also ghrelin as a result. Another article is the effect of electroacupuncture on always in obesity, in obese rats, reinforce the suggestion that acupuncture can reduce leptin resistance. Is an article of 2012. We have another article, a meta-analysis, is a recent meta-analysis, 2019, concludes that acupuncture relieves diabetes mellitus by reducing body weight through upregulating leptin level. We have another article which is important and which is recent, 2016. It was published in Clinical Nutrition and Diabetes and shows that acupuncture combined with metformin is more effective than metformin alone to treat diabetes, proving that acupuncture reduces insulin resistance and body weight. This one is a recent Chinese article, 2018. It has not been translated in English for as much as I know, but it brings the same conclusion that acupuncture is important in improving leptin and insulin resistance. So as you see, there are different articles. There are many. I think the fact that acupuncture is a safe, cost-effective, no side effects treatment, we know it. WHO recommended for that. We start to have quite a lot of promising results as well clinical studies as well as fundamental studies in the mechanism of acupuncture. And what we need now, especially we have a lot of studies about pain, for example, pain and acupuncture, cancer and acupuncture, we had a lot. But what we need for this obesity problem are further studies, future studies, which are more, we would need more fundamental studies, of course, about the mechanism, about leptin resistance and how acupuncture exactly works. High quality projects, we would need project with higher samples of patients, with standardized guidelines and protocols, double-blind or blinded studies, etc. But I think acupuncture could be an important player in the future for this big problem we have in the world. After having given a quick overview of mechanism in the obesity problem, and acupuncture in that, I would like to share with you some results of our experience, clinical experience in Switzerland, in the Sinomedica group, and show also what we would like to do in the future as a research, where we would like really to go as a private group, but it will not be so easy, but we will try. In our 7 clinics, we have a program that combines diet and acupuncture. We use a very low-carb diet and combine it with acupuncture. We don't use a ketogenic diet. The effects of these, the clinical effects we think happens during the treatment is a shift from anabolic to catabolic metabolism, a lowering of ghrelin and improving of leptin resistance, and a constant weight loss like that. At the end, we have many patients, as you will see later, which are really high overweight and obese. So they have high blood pressure, diabetes, sleep apnea, etc. One thing we observe always with weight reduction is that the patient, after a while, reduce and then at the end eventually stop high blood pressure medication. They even at a certain point, in some cases, are able to stop diabetes type 2, the medication. There is a documented improvement of non-alcoholic fatty liver disease. We are working with hepatologists in Switzerland. What the patients say as testimonials is that they have no hunger feeling. They have a very good energy level. They feel very, very fit, actually, better than before. They have improved sleep quality. They feel that as a life-changing experience, which I agree. If you lose 50 kilos, it really changes your life. Okay, some example. These are two clinical cases. Lady, 35-year-old, initial weight 95 kilos, 1.55 meters. The BMI was almost 40, so really obese. She lost 44 kilos in 1 year. Her BMI went from 39.5 to 21. Male patient, 47-year-old, with high blood pressure, high cholesterol, and other comorbidities. He started with 136 kilos, and he went down to 78, so he lost 58 kilos in 8 months. His BMI went from 42 to 24. This is, of course, pretty impressive. If I remember well, he had also knee pain, and of course he avoided to put a prosthesis on that. These are extrapolation of all the numbers we had in just two centers, Lugano and Locarno, which are two small cities in the south of Switzerland. The results, we took out we extrapolated the numbers of all the treatments we had, all the patients, only for weight, and we calculated how much was the average weight loss. So very simple numbers. What we could see is that we took the patients that at the starting point, they were between 80 and 185 kilos, between 2016 and 2019, so 4 years. We had 780 patients. We performed almost 12,000 treatments, and the patient lost average 15 kilos in 15 visits. Like you can see here, almost 15 kilos. So 1 kilo per week, average, which I think is not bad. This second sample of patients are patients from 100 to 185 kilos, always from the same centers, always the same years. There are almost 300 patients which are obese or almost obese. The amount of treatments were around 4,000 treatments, and the average weight loss was 23 kilos in 21 visits, in 21 weeks. The third examples I'm bringing you, these are one patient between 115 and 185 kilos, so obese. In the same time period, we had 110 patients, and we performed 1,500 treatments, and there was an average weight loss of 30 kilos in 30 weeks. These are just the numbers of all the centers we have, Lugano, Locarno, etc., in Switzerland, in the Sinomedica group, in 2020, so with the pandemic. And we perform around 25,000 treatments for obesity and overweight during this period, during 2020, which I think is a huge number. So the problem is really important in Switzerland as well as in the rest of the world, as we have seen before. Okay, these are some ideas about what I was saying before. We would like to study and to do studies. We are looking for universities wanting to help us to do that. Studies with a high number of patients to prove that with acupuncture and diet combined, we can reduce the weight, that we can reduce the weight without losing a lot of muscular mass or lean body mass. We would like to prove the fact that with analysis, urine and blood sampling, that with acupuncture we can improve leptin resistance and reduce ghrelin. We would like to, of course, measure different parameters here, blood pressure, diabetes, type 2, even the microbiome. We would like to do comparative studies eventually with bypass or other studies, and we think we are having a big amount of patients, so we could be able to perform this kind of studies or to see where we can go with that. Okay, I hope this thing until now was interesting. I have some take-home messages which I think are important. Obesity is a pandemic, is a huge problem. It's not something where we can say, okay, just eat less. Overweight and obesity is a multidimensional problem with a lot of aspects and with a neuroendocrine complex aspect, which is difficult to regulate with the brain, almost impossible. There is a growing scientific evidence on the effect of acupuncture on leptin-ghrelin mechanism. There is a promising clinical evidence, as we have seen, about acupuncture as a treatment for acupuncture combined with diet as a treatment for overweight, obesity. Acupuncture with a very low-carb diet works, and there is, of course, a need of more fundamental research on the exact mechanism of how it works. I have all the literature here, and I would like to thank Dr. Carillo to giving me the opportunity to participate to this symposium. Thanks everybody for the attention. I will be available for questions.